I want to tell you about a patient I'll call Margaret. She was 68 years old, retired school teacher, sharp as a tack, still volunteering at her local library 2 days a week. She walked every morning. She didn't smoke. She faithfully took her blood pressure medication. She ate what she genuinely believed was a healthy diet. Yogurt in the morning, a sandwich at lunch, dinner with her husband every evening. She was, by every visible measure, doing everything right. She came into my clinic for a routine check after a mild urinary infection. Nothing dramatic, nothing frightening, and we ran a standard blood panel, the kind we run on almost everyone over 60. When the results came back, I had to read them twice. Margaret had already lost nearly 45% of her kidney function. Almost half. Gone. And she had not had a single symptom. Not one. No pain. No swelling she'd noticed. No change in how she felt on any given morning. Her kidneys had been quietly failing for what we estimated was somewhere between 8 and 12 years. And she had absolutely no idea. That moment in my office, the look on her face when I told her, I have never forgotten it. And I don't think I ever will. My name is Dr. Cole, and I've spent over 2 decades as a physician with a deep focus on metabolic and kidney health, particularly in patients over 60. And I can tell you with complete conviction that what happened to Margaret is not unusual. It is, in fact, heartbreakingly common. Today I'm going to tell you exactly what the number one kidney mistake is. I'm going to show you precisely why it's so damaging, right down to what's happening inside those tiny microscopic filters in your kidneys at this very moment. And I'm going to give you a clear, practical roadmap for stopping it, and even reversing some of the damage, starting today. Stay with me, because what comes next changes everything. Here is the uncomfortable truth about your kidneys that most people, and frankly many doctors, never take the time to explain properly. Your kidneys are not a dramatic organ. They don't announce their distress. They don't send flares up into the sky when something is going wrong. They suffer in silence, year after year, while you go about your life completely unaware. And by the time kidney disease shows up on a standard blood test, by the time your creatinine rises or your GFR drops into an alarming range, you have often already lost a significant portion of kidney function that you cannot get back. The damage at that stage is permanent. Here is the number that should stop you cold. According to the National Kidney Foundation, approximately 37 million Americans are living with chronic kidney disease right now. That's 1 in 7 adults. And of those 37 million people, an estimated 9 out of 10 don't know they have it. 90% walking around, eating breakfast, going to bed at night, with quietly failing kidneys and no idea. And it's not just America. This is a global epidemic. The World Health Organization ranks kidney disease among the leading causes of death worldwide, and the numbers are climbing every single decade. Now, here is what makes this especially important for you, watching this video today, because you're over 60. And after 60, the rules change. As we age, we naturally lose a small percentage of kidney function each decade. This is normal. But when you layer on top of that natural decline the additional damage from the mistake I'm about to describe, the decline stops being gradual and becomes steep. What might have taken 30 years to become a problem in a younger person can become a critical problem in a senior in half that time. Time is not on our side after 60, but knowledge is. So let's use it. To understand the mistake, you first need to understand what your kidneys are actually made of. Because once you see this, the rest of the video will make perfect sense. Inside each of your kidneys, and most of us have 2, there are approximately 1 million tiny structures called nephrons. Think of them as the kidney's individual workers. Each one contains a microscopic bundle of blood vessels so fine, so delicate, that they make a spider's web look robust by comparison. These tiny vessel bundles, called glomeruli, act as precision filters. Every drop of blood in your body passes through them, over and over, all day and all night, every day of your life. Here is the analogy I use with my patients. Imagine the most delicate silk fabric you've ever seen. Now imagine dragging something rough and abrasive across it, gently, every day, for 30 years. At first you don't see any damage, but eventually those silk threads begin to fray. And once they tear, they do not repair themselves. Those nephrons, once destroyed, are gone permanently. So the question becomes, what is dragging? What is the abrasive force that's slowly, quietly tearing those delicate filters apart? The answer is not what most people expect. It is not just salt, though that matters. It is not just dehydration, though that matters too. The number one driver of kidney damage, the silent force behind the epidemic I just described, is chronically elevated insulin. Let me say that again, because I want to be absolutely clear about something. The number one kidney mistake is not a food you're eating, not a medication you're taking, not a single bad habit. It is a pattern. A daily pattern that almost every person over 60 in the modern world has fallen into without realizing it. And that pattern is this: eating in a way that keeps your insulin constantly elevated from the moment you wake up to the moment you go to sleep. Never giving your body a break. Never letting insulin come back down to baseline. Now, and this is important, insulin itself is not the villain. Insulin is a magnificent hormone. It is essential. It is the key that unlocks your cells and allows glucose, your body's fuel, to get inside. Without it, you cannot survive. People with type 1 diabetes, who cannot produce their own insulin, know this better than anyone. The problem is not insulin existing. The problem is modern life has turned our insulin system into something that never, ever switches off. Our great-grandparents ate 2 or 3 times a day. Real food, grown in soil. In between meals, insulin fell. The body rested. The filters in the kidneys got a break. Today, the average person is eating from the moment they wake up. The morning coffee with sugar or cream, the toast, the mid-morning snack, the packaged lunch, the afternoon biscuit, the dinner, the dessert, the something sweet on the sofa before bed. That is not eating. That is a constant trickle of glucose and insulin pouring through your system for 16 or 17 hours straight. Over years, those repeated insulin spikes cause chronic low-grade inflammation inside the blood vessel walls. And here's what makes this so dangerous for your kidneys specifically. Those tiny glomerular filters I described, the silk fabric, they're made of blood vessel walls. So when chronic high insulin inflames your blood vessels, it inflames your filters directly, day after day, year after year, until they start to fray. And here's the part that makes this especially insidious in people over 60. As you age, cells throughout your body gradually become less responsive to insulin, a condition called insulin resistance. Your pancreas responds by pumping out more and more insulin just to do the same job. So your blood sugar might look completely normal on a routine test. But behind the scenes, your insulin levels could be running 2, 3, even 4 times higher than they should be, silently driving that inflammation in your kidneys while your blood work appears reassuringly fine. Most people have never once had this conversation with their doctor, and that has to change today. Before I go any further, if you're finding this information valuable, if this is the kind of conversation you wish more doctors were having with you, then I want you to hit that subscribe button right now. Every week on this channel, I bring you exactly this kind of in-depth, clinically grounded health information because you deserve to understand your own body. Hit subscribe and don't miss what's coming. Now, let's talk about what you can actually do about this. Here's what nobody tells you. You don't have to overhaul your entire life overnight to make a meaningful difference in your kidney health. What you need is a strategy, and it works on 2 levels simultaneously. The first level is reducing the size of each insulin spike when you eat. The second level is reducing how often those spikes happen throughout the day. Together, these 2 shifts can dramatically lower your average insulin level and give those delicate kidney filters the relief they have been desperately needing. The first thing I want you to focus on is the quality of what you eat. When you eat heavily processed foods, white bread, packaged cereals, biscuits, fizzy drinks, pastries, the fiber has been stripped out, the natural structure destroyed. What's left hits your bloodstream like a wave. Glucose surges. Insulin surges to match. Your filters absorb that shock. When you eat real, whole food, eggs, fish, legumes, vegetables, nuts, seeds, the fiber, fat, and protein slow the release of glucose into your blood. Insulin rises gently, gradually. It's a rolling hill instead of a cliff edge. And over a lifetime, rolling hills are extraordinarily kind to your kidneys. Write this down. Fiber is your kidney's best friend at every meal. The second thing is your eating window. Here's what nobody talks about enough. Even if your individual meals are reasonable, If you're eating 6 or 7 times a day, including snacks, drinks with sugar, little bits here and there, your insulin never gets a chance to come back down to baseline. Your kidneys never get a rest. Here is a simple, sustainable approach that almost anyone over 60 can manage. Finish your last meal by early evening, let's say 7 p.m., and have your first meal the next morning at 9 a.m. That's a 14-hour overnight window, and most of it happens while you're sleeping. You don't have to call it intermittent fasting if that phrase feels intimidating. Just call it giving your body the rest it was designed to have. During that overnight window, insulin drops. Your body finishes burning through stored glucose. You tip gently into mild fat burning. Inflammation quiets, and your kidneys, for the first time in perhaps years, get a genuine rest. The third thing is movement after meals. I cannot overstate how powerful this is and how dramatically underused it is by seniors. A 10 to 15-minute walk after dinner causes your muscles to pull glucose directly out of your bloodstream for energy, meaning your pancreas doesn't have to release nearly as much insulin to manage what you just ate. Walking after dinner is not an old person's habit. It is one of the most metabolically powerful things a human being can do. It costs nothing. It requires no equipment, and it is worth more to your kidneys than almost any supplement you will ever find. The fourth thing is protecting your blood pressure. Chronically high blood pressure physically pounds those delicate kidney filters with force they were never designed to withstand. Know your numbers. Manage them. If you're on blood pressure medication, take it consistently. And understand that everything I've described today, better food, a fasting window, movement, all of it lowers blood pressure as well. The fifth thing is get your numbers checked. Every year, ask your doctor for a kidney function panel, your GFR, and creatinine. Ask for an HbA1c, which shows your average blood sugar over 3 months. And if at all possible, ask for a fasting insulin level, because that is the test that catches this problem years, sometimes decades, before your blood sugar ever shows an abnormality. Most people have never had their fasting insulin tested. That single number could tell you more about your kidney future than almost anything else. Let me come back to Margaret for a moment. When I sat with her and explained all of this, the insulin connection, the years of silent inflammation, the daily pattern that had been quietly eroding her kidney function, she was quiet for a long time. And then she said something I've thought about many times since. She said, asterisk, nobody ever explained to me that the way I was eating was hurting something I couldn't feel. Asterisk, and that is the tragedy of kidney disease. It doesn't hurt, so we don't connect our daily choices to it. We connect our choices to weight, to energy, to how our clothes fit, but not to our kidneys. Not until it's too late. Margaret was not careless. She was not irresponsible. She had simply never been given this information. She had been eating what she thought was a balanced diet, but it included a lot of packaged foods, a lot of snacking throughout the day, very little protein, very little fiber, and almost no movement after meals. She had no idea that every day, for over a decade, she had been keeping her insulin elevated almost constantly. We made changes together. Slowly, sustainably. She shifted to eating real food. More eggs, more fish, more vegetables, more legumes. She started having her last meal by 7 p.m. and her first at 9 a.m. She began taking a short walk after dinner with her husband. They called it their kidney walk, which I thought was wonderful. 6 months later, her kidney function had stabilized. It had not reversed. The damage already done was permanent. But the progression had stopped. Her blood pressure had come down. Her fasting insulin, which we tested privately, had dropped by more than half. She told me she felt better than she had in years. And they were doing everything right now. It is never too late to change the trajectory. But you have to know what you're changing. And now you do. So let me bring all of this together for you clearly, because I want you to leave this video with a plan, not just information. Starting today, here is what I want you to do. Eat real food at your meals. Prioritize protein, fiber, healthy fats, and vegetables. Make processed, packaged foods the exception, not the foundation. Give yourself an overnight fasting window of at least 14 hours. Finish eating by early evening. Have breakfast a little later the next morning. Let insulin come home to baseline while you sleep. Take a short walk after at least one meal a day, 10 minutes minimum. Make it a non-negotiable. Your kidneys will thank you in ways you can't see, but absolutely will feel. Know your blood pressure and keep it managed. This is not optional. This is part of your health. And get your kidney function and metabolic numbers tested every single year. Ask specifically for GFR, creatinine, HbA1c, and fasting insulin. Put on your calendar right now. The body wants to heal. It just needs the right conditions. And everything I've described today creates those conditions, not just for your kidneys, but for your heart, your brain, your liver, your blood vessels. All of them at the same time. Because here's what I've come to believe after more than 2 decades of practice. Kidney disease, heart disease, fatty liver, type 2 diabetes, vascular dementia. These are not separate conditions with separate causes. They are different expressions of the same underlying problem. The same metabolic dysfunction. The same chronically elevated insulin. The same slowly smoldering inflammation. Fix the root cause, and every branch of that tree begins to heal. I think about Margaret often. I think about the 8 or 12 years that passed silently, without a symptom, without a warning, without a single moment where her body told her something was wrong. And I think about you, watching this video right now. Maybe you've had a vague sense that something isn't quite right. Maybe you've had a blood test result that concerned you slightly, or a blood pressure reading that's been creeping upward. Maybe you're just someone who loves their family and wants to be here, truly here, healthy and independent and fully present for as many years as possible. That is what this is really about. Not kidneys as an isolated medical subject, but your quality of life, your independence, your ability to wake up tomorrow morning and feel well and do the things you love with the people you love. That is worth protecting. And now you know how. I have one question for you, and I'd love for you to answer it in the comments below. Have you ever had your kidney function or your fasting insulin tested? Do you know your numbers? Tell me, because that conversation in the comments could matter to someone else reading it today. If this video helped you, if it gave you something your doctor never quite had the time to explain, please share it with someone you care about. A spouse, a sibling, a friend. Because the tragedy of silent kidney disease is that it's preventable, but only if people know. And sharing this video is how we change that. And if you haven't subscribed to Natura Karai MD yet, please do it now. Every week, I bring you this kind of honest, in-depth, research-backed conversation about aging well. The conversations your doctor wishes they had more time to have with you. Hit that subscribe button and join our community. Next week, I'm going to be talking about the early warning signs that your heart is working too hard, and 3 things you can do before your next cardiology appointment that could genuinely save your life. You don't want to miss that one. Thank you for being here. Thank you for caring about your health. I'll see you next week. Asterisk, everything I've shared today is general medical information based on published research and clinical experience. It is not a substitute for personalized medical advice. Always consult your own physician before making any changes to your diet, medications, or health routine, particularly if you have existing kidney disease, diabetes, or cardiovascular conditions. Your doctor knows your individual health history, and that context always matters. Asterisk.